So, in our care for children with congenital heart disease, we now have a population of patients with very complex problems who are surviving and having complex treatments and then being discharged home. And for the parents of those children, one of the most stressful times is when they leave the hospital where they've had the security of all of the experienced staff, the monitoring, and then they're on their own, if you like, in the home environment. We put as many supports as possible into the care of the children in the community because it's really crucial that they're closely monitored and that any problems that they might arise are detected early. Particularly with children with complex congenital heart disease, we know that one of the big issues that has arisen in clinical practice is what people call interstage mortality, where very sadly some children pass away outside of the hospital before they come back for the further stages of surgery. And in Belfast here, a number of years back, we initiated a research project to try and provide support within the home using technology, basically using video conferencing technology to try and make a regular link to those families in the home so that they got both psychological support and also with an experienced member of staff being able to view the child in their own home. And we have found through the outcomes of that research that form of monitoring not only is a great support to the parents, but in terms of healthcare, we've demonstrated that it brings benefits to those patients in terms of early alerts to problems that might arise, reassurance to the parents when things are not so important, and in fact a saving in terms of money even to the health service, preventing unnecessary contacts with healthcare professionals outside of the hospital. But I suppose more importantly, bringing those children to hospital when they really need to come. And so we started this as a research project, and now it has become integrated into our clinical practice. And one of our senior pediatric cardiac nurses, Rosie Brown, is the key to this project, who makes regular links to these parents. We in their home, we give them a small video conferencing unit that connects through their home broadband to our video conference room here in the pediatric cardiology department. And all of the time we have a number of patients and families at home on that home monitoring scheme. We think it is an important contribution to their care and an important beneficial program to them in terms of preventing both morbidity and we believe mortality in that complex group of patients.
And how many people would you have on that scheme?
We have the capacity at any time to have up to 20 patients on the program. The technology has obviously improved since we started this and things have become much simpler. We've worked together with a video conferencing company to install the video conferencing units in the home. We try to make it as simple as possible so that perhaps young people are very au fait with technology, but we have to be cognizant of the fact that for the parents to feel comfortable with it, it has to be very simple to use, and basically the parents just have to have the video conferencing system switched on at the time when we make the contact with them. And by and large that works very well. As I say, the technology has evolved over the years and improved. I think there's enormous capacity in terms of research in the future for us to bring this to a different level, to use new technologies that are evolving, and also to measure other parameters in the home. At present we monitor oxygen saturation levels. With this group of patients, their weight is also a very good marker of their well-being, their growth. But we are very keen in future research to explore other things that we might be able to do at the home. For instance, it would be really useful at times if we could record the heart rhythm and ECG. We don't have the capacity to do that remotely in a very young population. There's lots of work being done in adults for that, but not in the pediatric population.
Excellent, thank you. Very good.
Okay.
No, I know. I was just going to ask Frank about the cost.
Yeah.
You know,
So,
especially
yeah.
the cost of this going into the homes.
The cost really relates now only to the video conferencing unit, because the parents, the majority of parents that we link into have their own home broadband in, and the system links into that. Where they don't have home broadband, we pay for that to be installed in their home. And as I say, we've worked with a video conferencing company to do that. We found that we've been doing that less and less as broadband and technology becomes more widespread in the community. So the actual costs are minimal cost. The video conferencing unit goes in. I should also say that our plan usually when we put these into the family homes is that they stay there for a limited period of time until the baby or young child is through a period where we think that they don't need it. But as Rosie will, I'm sure, verify, the difficulty sometimes is in getting the parents to stop the leak, because they do find it really beneficial and it's there like a safety blanket for them. And so we try and rotate the equipment, and we do. But usually we find that the time scale that it's in the home is a bit longer than we might have initially planned. And